did everything, I was like, I never want to eat out at a restaurant because I never know if the food's going to be washed or not. And I never want to travel to endemic areas.
These guys aren't on.
Oh, yours on? Where's that stick? Is that right? I don't know if I actually can get one. I'm not strong enough. Nathan.
Yeah, I think that's Amber's old.
Did I get it? You can reach it without the stick.
Yeah.
Okay. Let's reject those. So helminths is a fancy term for worm-like parasites that infect humans. There's some soil-transmitted helminths that refer to intestinal worms, and so those are the ones that we're mainly going to talk about today. There are some other that are tissue, but we'll mainly, for this part of it, we'll just talk about roundworms that are soil-transmitted. But basically, they get it through contaminated soil. There are stages that the helminth goes through. It's egg, larval, and adult stages. And many of them can remain viable in the soil for years. So how are they spread? The first one is yesterday. I'm sure you heard fecal-oral a bajillion times. So it's fecal-oral transmission. And then basically they complete the cycle in the human intestines. And then it recycles, and then they poop it out, and then the cycle begins, and people can get auto-infected. And then you can also get it from eating undercooked beef, pork, fish, or crustaceans, and then direct penetration of the skin by the larvae. And the risk factors for these are those who live in low income and poor sanitation, close proximity to contaminated freshwater sources. Malnutrition is associated with higher morbidity and mortality in those who have that are immunocompromised. So the three that we're going to talk about today are the Ascaris lumbricoides and the Enterobius verbicularis and Necator americanus. The other two down there I did not add. They weren't on your list. Mainly they mentioned these three up top. So Ascaris lumbricoides is a large roundworm. And it can grow up to 14 inches. I was like, 14 inches in your belly. It is the most common parasitic worm infection in humans worldwide, but it's uncommon in the U.S. Most cases occur in refugees, travelers, immigrants that come from endemic areas. Humans are affected by eating the eggs, often in food that is contaminated by human feces. So it's possible for eggs to be transferred from your hands to your mouth after touching something that has been touched with contaminated soil. And you can it's also related to a roundworm. It's called the asun. It's the roundworm found in pigs. After cysts are ingested in food contaminated with feces, or larvae are ingested in raw or undercooked pork. That's why my husband makes fun. Anytime he cooks pork, I don't like it to be, I want it to be white. White. So this is basically the life cycle. So an egg is hatched in the duodenum and resulting of a larva that penetrates the wall of the small bowel. And they migrate via portal circulation up through the liver to the heart and out to the lungs. Then what happens is this larva ascends the bronchial tree into the oral pharynx, and basically you swallow this. And then it goes back down to the small bowel, and that's where they develop into an adult worm. They mate, they release eggs into the stool, and the life cycle is completed in about 2 to 3 months, and then the worms can live 1 to 2 years. Have you guys seen that movie Snatched yet with Amy Schumer? Is anybody in here? Raise your hand if you have. That was the best part, and it's later down in the tapeworm area, but we'll get there when I get it. So this is a nice little graph from the CDC. Kind of gives you the life cycle and how it begins and how it ends. So what are the signs and symptoms? So some of these, as they're traveling up the lungs, you can get like a bronchial irritation. So these people have coughing, wheezing, and sometimes they can have bloody sputum and other respiratory symptoms. Some people notice infection when a worm is passed in their stool. And I can't imagine, but sometimes if you cough up a worm, can you imagine coughing and coughing up a worm? And if it's a large number of eggs have been ingested, they may have more symptoms. They can sometimes have blockage of the small intestines and or bowel obstruction, basically, if they get enough worms in there that causes an obstruction. So some differential diagnoses. If it's just a generalized abdominal pain, you can have cholangitis, cholecystitis, and obviously if they have respiratory symptoms, coughing, wheezing, you think of asthma, obviously intestinal obstruction, or appendicitis, depending upon where their pain is. How do you diagnose it? You diagnose it with microscopic examination of the stool. So basically you would see adult worms in the stool, I'm not dying when I wrote this, emerging from the nose, mouth, or the rectum. Sputum analysis, you can see the larvae there, or what's called Charcot-Leyden crystals. They're collections of crystalloid composed of eosinophilic proteins. And then in these patients, while they're highly infected, your eosinophilia may be markedly high while these migrate up through the lungs. But once they get down into the intestines, your eosinophilia should be decreased. So on a chest x-ray, if they're traveling up, you can have what looks like an infiltrate. You could actually use worms. I was telling Dr. Latassi, I guess she does not like worms. So when she and I were talking about the lecture that she's going to give you guys for the, she's doing HIV and helminth medications, but she was like, anytime I mention worms, she would squirm. How do you treat these? These main ones are mebendazole, albendazole, and ivermectin. And sometimes, if they obstruct the small bowel, you will have to go in and do surgery or endoscopic extraction of the adult worms. So let me see if this. I tried it again. Let me see if I can do it. But this one, what I did was I did a. Oh, it's not there yet. Okay. So how do you prevent washing your hands well before you touch any foods? Washing, peeling, cooking all raw vegetables and fruits before you eat it, and then not eating undercooked or unwashed vegetables in an area where human feces is used for fertilizer. I was thinking, where is it that they use human feces for fertilizer? So I'm not going there. And then not defecating outdoors. Did you guys hear about the lady the pooping jogger?
In Colorado Springs?
Yeah. Did they ever catch her? She was jogging, she would jog, and she'd stop in front of someone's yard, and there would be like children like not too far from her, and someone witnessed her pooping, and then she just jogged on, and then bitch, they caught her doing it several times. She was jogging, poop, get up, and I don't know if they ever caught her. So they called her, I think it was a jogger, I can't remember what they called her. But she'd be one of those people. You would think that's just a common thing.
I've seen it on the news somewhere.
Okay. So this is a female roundworm and a male. The females are larger than the males. So let's think this one.
You like those?
Yay.
Yay, Loser Society.
Oh, yes.
The volume working? Oh, great.
I don't know.
Okay, now the volume's not working. What?
That hat was
Ascaris is a roundworm, the human digestive tract.
Can't stand worms.
When eggs are swallowed, they hatch into microscopic larvae that make their way from the small intestine into the bloodstream. There they are carried to the lungs, where they climb up the host's airways and are swallowed back into the intestine when they reach maturity and breed. Usually, adult worms stay in the digestive tract where they can live undetected for years. In Brittany's case, it's likely her fever made her body too hot for the worms. In this inhospitable environment, these Ascaris worms head for the nearest exit, crawling up her esophagus and into her airways, triggering her cough.
My biggest fear was that I was going to keep coughing up worms.
In extreme cases, Ascaris worms can cause secondary infections and intestinal blockages, which can be fatal.
Oh my God. Okay. Blockage.
Probably cut it out.
They're blocked in a small intestine.
Something wrong with it.
Because I thought it was cool.
It's just like take my
Inside spaghetti. No, they're not.
Spaghetti.
And then you can tell you that pus and secondary infection. Okay, that's enough.
Probably.
This is my favorite, the pinworms. Does anybody work in peds or had children that have had pinworms or know anybody who had pinworms? It's amazing. So pinworms are, the fancy term is enterobiasis, which is intestinal infection by the pinworm, which is Enterobius vermicularis, usually commonly in children. Humans are considered to be the only host of the E. vermicularis and transmitted human to human. So it's the most common helminthic infection in the U.S. So the roundworm is most common in worldwide, but in the U.S., pinworms are our friends. So most cases occur in school-aged children, adults who care for children, or family members of an infected child. So you always kind of think of this when if you work in peds, family practice, anything like that, when someone comes in with their complaints, which we'll see in a minute. So how do pinworms, what's the pinworm life cycle? So eggs are deposited in the perianal folds. So infection results from transfer of the eggs from the perianal area to fomites, such as clothing, bedding, furniture, rugs, toys, toilet seats. The eggs can survive on the fomites as long as 3 weeks at normal room temperatures. So again, that's why you need to squat or put a thingamajigger down when you go to public toilets. Okay? Self-infection occurs by transferring infected eggs to the mouth with hands that have been scratched in the perianal area. So thumb sucking and nail biting are risk factors. And I used to have a friend in PA school, he always bit his nails. Now when I was reading this, I was thinking, he could be a pinworm carrier. So some small number of eggs may become airborne, and these can actually be inhaled. But these would be swallowed, and they would basically follow the same developmental stages as ingested eggs. Following ingestion of the infected eggs, the larvae hatch in the small intestine. So while they're in the small intestines, The pinworms reach maturity once they hit the lower GI tract, which is the large intestines, and that occurs within 2 to 6 weeks. The egg-carrying females migrates outside while you're asleep, and they go outside the anus and they deposit eggs around the rectum. So it's the sticky gelatinous substance in which the eggs are deposited and the movement of the female worm that causes perianal pruritus. So basically, if you have a kid or a mom with a kid that comes in and they say, my kid just says he just scratches his bottom all night long. This is the first thing you're going to think of because it's pretty common. But basically, I was sitting there thinking, oh my gosh, so when the worm comes out, and she's laying the eggs, and she's moving around, that is what's causing the itching. So then what they do, it itches, and they scratch, they get a worm or an egg, and they suck their finger or put it in their mouth, and then that's how it starts. It keeps doing it. Anyway, so here's a nice little CDC map of pinworms. So the eggs on the perianal fold. So basically, sometimes people can sit on it. They're naked, sit on a bed. There might be an egg on there, and it goes in there, and it starts coming all over that. Then they scratch, eat it, grows, comes back out. So signs and symptoms. So most infected people have no signs or symptoms, but basically some of them experience perianal pruritus. So some people can develop secondary infections from the scratching, and they get what are called excoriations from excessive scratching. Sometimes, I read that they can actually, the females can migrate up, and they can cause female genitoury tract itching or vaginitis. And then some people can report abdominal pain, especially if it gets up and then insomnia being a constant scratching. And in some cases, they can obstruct the appendiceal lumen in cases of appendicitis. But there really wasn't, when I read it, there wasn't really a lot of study on that. I think it just happened that they had appendicitis and they also had pinworms. So there really isn't true correlation between the two. So how do you diagnose it? The first option is to just look in the perianal region for the worm, eggs or bubbles. And usually it's done 2 to 3 hours after the child goes to sleep. Because you'll see it come crawling out. The second option is Scotch tape. Remember me telling you the story about the lady that we told to do, she thought she had pinworms? Do y'all remember that story? So we told her to basically you take Scotch tape and you would just take the sticky part and you put it up to their rectum and you get eggs or worms on the actual sticky part. And that's how you do it. And then they look at it under a slide. She, however, pooped and then wrapped Scotch tape all around it. That's not and so, sometimes you can do this 3 consecutive mornings right after the infected patient wakes up. You don't want them to go take a shower, because if they shower, they may wash out the eggs or the worms from their bottom. And then the third option, this kind of really grossed me out, is analyzing samples from underneath their fingernails under microscopy, because you can get eggs or, worms from underneath the fingernails. So, but since pinworms, eggs, and worms are often sparse in the stool, that's why you have to do multiple stool samples. And then sometimes you can do serologic testing for diagnosing pinworm infection. It didn't really tell me if there was a specific marker for the pinworm infection. So just know diagnosing is either to look at the area or you do the Scotch tape method. And this is just a little example on how they do a sample. I was thinking, you're not going to be in the doctor's office unless they just happen to wake up 2 to 3 hours later and you bring them in. But then that's what they do. They look, the tape side that's sticky should have the eggs and the worm on it, and you can look at it under microscopy. So, treatment. These generally are not harmful to anybody. The prevalence is high and reinfestation is common. Treatment is only indicated for symptomatic infections. However, most parents, if my kid had pinworms, I would want to be treated. So most of them seek treatment if their child has been infected. So again, albendazole, albendazole, and there's another one, parental amioate. Most of these are done in single doses. There have been times where I saw where you could do a single dose or a single dose times 3 days. But you can also give them antipyretic creams to help with itching down there. I think basically if you get a barrier, that will help the itching. So prevention, wash your hands with soap and water after using the toilet, changing diapers, and before handling any foods is the best way to prevent pinworm infection. People who are infected should bathe every morning to get rid of any worms or eggs that are happen to be down there. Showering is better than taking a bath, because basically taking a bath, it just floats around and eventually we just find its way back up there. That's why I don't take baths anymore. I used to love baths as a kid, you know, but then as I got older as an adult, you lay there in the bath and you just see all your dead skin kind of float around on the top, and I was like, yeah, I don't want to do baths anymore. But, so if I do a bath, you'll have to do bubble bath where I don't see my own skin floating around. So infected persons should also keep their nails trimmed. So if they are scratching, their nails are short, hopefully they won't be transferring it from underneath the nails into their mouths. And then obviously avoid biting the nails. Again, if you're scratching and it's under there, you bite your nails and you're basically reinfecting yourself. And then changing bed linens daily, which is kind of hard to do, especially with small children. But if your kid knows someone who has it, I'd be changing them every day. And so this is a picture of the pinworms that's around the anus, and these are the small little worms on the vision tape. So these are pinworms that they saw on a colonoscopy.
I think the small ones are worse.
Professor Butts?
Yeah.
So could you like see that in stool? Is that a way you could?
You can, but they said, you know, like, it's not, I guess for some reason, I don't know if they don't stick because they're too sticky to stick in the stool, but they say, like, you just don't commonly see it in there. So for these guys, the best way is to visually see it or use a sticky tape. I myself, neither of my kids, knock on wood, have ever had pinworms. So, the next one we're going to talk about are hookworms, or Necator americanus, and then there's also something called Ankylostoma duodenale. So mainly, those are just the two species. They're basically under the term of hookworms. Hookworm is also an intestinal parasite of humans. The main two species are what we just talked about. They pretty much act the same, so they're just made in one big presentation. So hookworm infection is transmitted primarily by walking barefoot on contaminated soil. And I remember as a kid, I used to walk barefoot all the time out in the backyard. We even had a dog. And so now my kids, I don't allow them to walk in the backyard barefoot anymore. Because now we have a dog, Georgie. And Georgie had a bout of worms. I don't know what kind of worms it was,
Probably around here.
but he had worms. It was bad. He's all better. So the life cycle of the hookworm. So hookworm infections occurs when eggs are passed in the feces of an infected person. So if the infected person defecates outside, again, why are people pooping outside? In bushes, in a garden or a field, or if the feces from an infected person are used as fertilizer, eggs are deposited on the soil. So the eggs mature in the soil and then release larvae. The larvae penetrate the skin and are carried through the blood vessels to the heart and then to the lungs. They again ascend the pharynx and then these are swallowed as well. Adult worms live in the small intestine where they attach to the intestinal wall with resultant blood loss by the host. So the thing with the hookworms, they have this, these teeth that they hook into the small intestines and they suck the blood. And so these patients sometimes can have develop anemia from the worms. So most adult worms are eliminated in 1 to 2 years, but the longevity may reach several years. So symptoms, they may be light if they, or maybe even be asymptomatic. So the first signs of cutaneous infection is by a intensely pruritic, erythematous, or testicular rash, usually on the hands or their feet. Its severity is generally proportionate to the number of infecting larvae. The person with a heavy infection may experience abdominal pain, diarrhea, loss of appetite, weight loss, fatigue, and anemia. So again, sometimes these people can look like your regular colitis patient, your Crohn's patient. Migration of the large numbers of larvae through the lungs occasionally causes what's called Loeffler syndrome. And it's basically coughing, wheezing, eosinophilia, and sometimes hemoptysis. So again, irritation of the larvae trying to go up to the bronchial tree. So sometimes you get what's called cutaneous larva migrans. So it occurs when an animal hookworm infects humans. It is caused by the larvae as they migrate through the skin. It causes itchy, erythematous, serpiginous skin lesions. So basically you can see the worm moving in your foot. There's a video, I couldn't find it, but this lady had it. I think she stepped on something outside and eventually migrated up to her chest wall. It was like moving around on her chest. So in these differential diagnosis, someone has acute anemia due to blood loss, uveitis, asthma, contact dermatitis, because it may look like that with the blister, things on my hands or the foot. Also could be scabies. So how do you diagnose it? You look under the microscope at the stool. So what you'll see are thin-shelled oval eggs that are readily detected in the fresh stool. You could do a CBC, looking for iron deficiency anemia. And the diagnosis of that cutaneous larva migrans is basically based on clinical physical exam, because on those patients, the eggs are not present in the stool. Again, treatment, albendazole, parental, parental, and then if they are severely anemic, you want to treat their anemia as well. And how do you prevent these hookworms? Basically preventing unhygienic defecation and avoid direct skin contact with the soil. So when you're outside, wear shoes, especially if you have dogs, even though you may treat your dogs for hookworms. Some dogs may get in your backyard or front yard, poop, you get it that way. There you go. Treat your cats and dogs. Those are the pictures of hookworm, and this is one on the intestines where it's actually causing the blood loss. Here it's
Could a parasitic illness be the reason an entire population was thought of as lazy? That may, in part, be what rampant hookworm infections did to the rural poor in the American South for over a century. I'm Anna Rothschild, and this is Gross Science. Human hookworms are nematodes that live in warm, moist climates throughout most of the world. You get them by coming in contact with contaminated soil, say by running around barefoot. That's when tiny hookworm larvae, under a millimeter long, can wriggle into your skin. This isn't painful, but it might cause a little itchiness at the point of entry called ground itch. Meanwhile, the larvae begin a grand tour of your body. They enter your bloodstream and pass through your heart en route to your lungs. Then they migrate up your windpipe into your throat, and you swallow them, at which point they make the long journey down your digestive tract. Finally, they end up in your small intestines, where the larvae mature, mate, and bite into the lining of your gut to drink your blood, often for years at a time. The females release thousands of eggs per day, which you poop out, starting the cycle again. People have been known to have hundreds of hookworms in their guts at a time. And the more worms you have, the worse your symptoms can be. A hookworm infection rarely kills you on its own, but it can cause anemia, protein deficiency, gastrointestinal problems, weight loss, and fatigue. Basically, it makes you weak and tired. And if you have a bad case of it as a child, the severe anemia can lead to stunted growth and stunted cognitive development. And that's where the stigma of the lazy, slow Southerner comes in. Now, I'm not sure how prevalent this prejudice is in America today. It wasn't something I ever heard growing up. But when you recognize that in the early 20th century, when this stigma was quite strong, up to 40% of people in certain parts of the region had hookworm, that stereotype, while deeply unjust, starts to make a bit of sense. It's no wonder that workers were weak and children had trouble in school. So why did so many Southerners have hookworm? Well, both the climate and the sandy soil of some parts of the South were ideal for the parasite's life cycle. But on top of that, it largely affected poor communities where kids may have run around without shoes, and effective sanitation and plumbing weren't common. It was one of a few diseases in the American South that thrived because of widespread poverty, and likely also perpetuated that poverty. In the early 1900s, there was a huge campaign to eradicate the disease and educate people about the parasite. It's totally treatable with medications, but preventing reinfection requires some pretty fundamental lifestyle changes. It ended up taking decades to get it under control, but today, very few people in the US actually get hookworm. Many other places in the world, however, are not so lucky. Right now, according to the CDC, up to 740 million people are infected with hookworm. It's just one of many neglected diseases that sap people's vitality worldwide and may trap them in poverty. And if that's not gross, I don't know what is. Ew. This video was inspired by Rachel Newer's excellent article for Nova Next on hookworms in the American South. She goes into way more detail about the history of the disease, the impact of it on the region, how it was first identified, and I thought that was interesting. I was like, I've never heard of the lazy Southerner. Have y'all ever heard that term? That's kind of interesting. And the next one is the whipworm, Trichuris trichiuria. Humans are the only known host of T. trichiuria, and no animal reservoirs are recognized. It's again spread through the fecal-oral via ingestion of eggs, contaminated food, or contact with contaminated hands. After ingestion, the eggs hatch in the small intestine into larval form, which penetrate the intestinal mucosa. The whipworm acquired the name by the distinctive appearance or resemblance of the adult worm to the handle of and lash of a whip. So that's a picture of a whipworm down there. Symptoms: most infections are asymptomatic. Patients with fewer than 100 worms are frequently asymptomatic. However, they may present with lower abdominal pain, discomfort, flatulence, diarrhea, or constipation. So it can kind of, again, sound like your run-of-the-mill gastroenteritis. Patients with heavy infection may have hundreds of thousands of worms and may present with lower or epigastric pain, vomiting, abdominal distension, anorexia, weight loss, anemia, diarrhea, something called tenesmus, where they have painful strain when they go to the bathroom, or they can also develop rectal prolapse. Trichuris dysentery syndrome is observed in heavy infections and characterized by bloody, mucoid diarrhea, small, frequent stools, tenesmus, anemia, and growth retardation. Again, the differentials are scarus, colitis, constipation, diarrhea, mediasis. So it's basically, you've got to get the good history. So how do you diagnose it? Again, microscopic examination of the stool.
The eggs are bile stained with characteristic barrel American football shape with the translucent colored buds. So if you're looking underneath the microscope, that's what an egg would look like. Again, treatment is mebendazole, albendazole, and then if they are anemic, you would treat their anemia as well. And the last topic we're going to talk about are flatworms or platyhelminths. The first one are flukes or trematodes as they're named, schistosomas, and then tapeworms or cestodes, which is taenia. Schistosomiasis is caused by blood trematodes, so it is by far the most important trematode infection. It's also known as bilharzia. Schistosoma is the only trematode that invades through the skin. All other ones are via ingestion. Basically, it's spread by coming in contact with contaminated fresh water, ponds, lakes, rivers, etc. About 200 million people are affected worldwide. It's second to malaria in the most devastating parasitic disease. It's found in sub-Saharan Africa, the Middle East, Southeast Asia, and the Caribbean. The three main species infecting humans are Schistosoma haematobium, S. japanocium, and S. mansoni. All have similar life cycles involving freshwater snails. So these are, you see a little story, and there's the word snail in it, schistosomiasis. So humans are the main reservoir of the infection. Basically, the human host, eggs containing Myristidia are eliminated with the feces or urine into water. And there in the water, the eggs hatch and release Myristidia. The Myristidia swim and penetrate a snail. So then within the snail, the Myristidia progress through 2 generations of sporocytes to become Cerasteriae. And that's what's the infective, is the Cerasteriae. That is the infectious form of the parasite. It's released from the snail and penetrates the skin of the human host. So during penetration, these are transported through the vasculature to the liver. And in the liver, they mature into adults. So if you're, basically these are people that are wading in water, swimming in these waters. The paired male and female adult worms migrate, depending upon their species, to the intestinal veins of the bowel or rectum or to the venous plexus of the GU tract, where they reside and begin to lay eggs. So a couple of these, and I think I put it in another side down the ways, 2 of them go to the bowels and 1 of them goes to the GU tract. And again, here's the nice little CC map. Signs and symptoms. Most infections are asymptomatic when they're first infected. However, a few days later, they may develop a pruritic papular rash where the Cerasteriae have penetrated the skin. They can develop also what's called acute catamia fever 2 to 4 weeks after an exposure. They get fever, chills, cough, nausea, malaise, and then they, too, at this time will have marked eosinophilia, and it can resemble something called serum sickness. But these are more common and severe in visitors rather than in residents. You can also develop what's called chronic schistosomiasis. Without treatment, schistosomiasis can persist for years. They can develop abdominal pain, hepatomegaly, metachesia, hematuria, and problems passing urine. And with this, you also have an increased risk of bladder cancer. Rarely, eggs are found in the brain or spinal cord, but if they do, they can cause seizures, paralysis, or spinal cord inflammation. And again, how do you diagnose this? Microscopic examination of the stool and the urine. In the stool, you're looking for the stool, it's for S. mansoni or S. See, I practice these the night before, and when I get here, I can never remember what it is. So the urine is for the S. haematologium eggs. Since eggs tend to be passed intermittently and in small amounts, so again, for these, you may have to do multiple stool samples, or again, you could do serologic testing. for this, the treatment here is praziquantel, and there are different doses for the different species. In these patients, you'll want to recheck the stool in about a month after they've been treated to make sure that there are no eggs or things left over, because then you may have to retreat them in 2 to 4 weeks. Because what's nice about these are, most of these are all like 1 day dosing. Like this one is both just 1 day, 1 time. Prevention. In visiting countries where schistosomiasis occurs, avoid swimming or wading in fresh water. Drink safe water. Boiling your water before you drink or bathe in it. And then they say you could do some vigorous towel drying if you accidentally waded or got in contact with contaminated water. Can help prevent the parasite penetrating the skin. And then tapeworms. Teniasis in humans is a parasitic infection caused by the tapeworm species Tinea saginata, which is the beef tapeworm, and Tinea solium, which is the pork tapeworm, and Tinea asiatica, which is the Asian tapeworm. The bottom two, it's actually the Asian one is also found in the pork, basically, but it's pigs in Asia. Humans become infected by eating raw or undercooked beef or pork. Those are two there. The life cycle, eggs or proglottids are passed with the feces. The cattle and pigs eat the contaminated vegetation. So once inside the animal, the Tinea eggs hatch in the animal's intestine and migrate to the striated muscles to develop into cysticerci, causing a disease known as cysticercosis. Humans become infected by eating raw or undercooked infected beef or pork. So ingested cysts attach to the small intestine and develop into adult tapeworms over the course of 2 months. The adult tapeworms migrate to the anus and then are passed in the feces. So I need to tell my sister this, who likes to eat her steak. Like, she wants the steak almost like moving. She likes bloody, bloody steak. I'm like, I don't like mine. I used to cook mine like well done. And as I got older, I realized I'm just eating a boot when I do it that way. So I now eat mine. Some places will do it, but I order it medium plus. So it's just a little bit of a peak center. Because what happens is I order medium, I usually get medium rare. I have a bad luck when I eat steaks. That's why I don't eat steaks that often. But that's what happens. I order medium plus. So if you guys ever like that, you don't like the mediums and it becomes too rare, just order a medium. So again, here's a nice little graph from the CDC. So signs and symptoms. Many infections are asymptomatic. Patients with T. saginata are often experience more symptoms than those with T. solium because the tapeworm is larger. You can measure up to 10 meters. Meters, not centimeters, meters. Tinea solium tapeworm infections can lead to cysticercosis, which is a disease that can cause seizures. Typical symptoms of teniasis include vague GI complaints of abdominal pain, cramps, anorexia, diarrhea, weight loss, or malaise. So the most visible symptom of teniasis is the active passing of proglottids, or where they call them tapeworm segments, through the anus and in the feces. In rare cases, tapeworm segments become lodged in the appendix or the bile and pancreatic ducts. And I don't know if Sally talked to you guys yesterday about the appendix at all. She and I were talking about it, that there are some studies now saying that the appendix, because we never really knew what the appendix was for, right? It was just like an appendage that sat there. But I think recent studies have shown that the appendix is like a catch-all. So like, let's say you have some type of diarrhea that it totally washes out all of your good flora. Your appendix still has them stuck in there, and basically it just releases it back out into your colon. I'm like, oh, that's pretty interesting. So it's interesting that all these, like some of these worms get trapped in the appendix because it just kind of sits there and festers, and so I thought that was kind of interesting. Because we never really knew what the appendix is for. Differential diagnoses: gastroenteritis, appendicitis, chronic anemia, irritable bowel syndrome, or obviously a tumor. See, my differential will be tumor first. That's just So how do you diagnose it? Microscopic stool examinations. Again, examining 3 stool samples on different days to increase the sensitivity of the microscopic methods. For larval disease, you can do some imaging. You might have to do a CT. If they develop cysts in the brain, you have to do like an MRI of the brain to look for cysts there. Treatment, praziquantel is the medication most often used to treat active teniasis. So, and then there's something called miclosamide. It's an alternative, but it's not available in the U.S. So the picture of the tapeworm, the beef, and then the pork. Oh, this one is more, I thought it was kind of interesting because it's actually a worm in the person's eye.
And then there was no relief for his pain. So when he came to us, and I happened to look inside his eye, I saw something white moving inside there. Now watch closely at this patient's eye. There is a silvery shining object inside the patient's eye. Now when the nurse with the cotton bud touches the eye, there is some exaggerated movement. And it looks like coils inside the eye. This can mean only one thing. There is some living object inside the eye that looks and behaves like a worm. Now we have to make sure that this is indeed a worm. If it is a worm, it will in all likelihood escape to other parts of the body the moment we touch it or interfere with it. So to prevent that, now the nurse has barred its posterior movement with a cotton bud. Now the cotton bud has to be placed at least near the center of where the worm's body is. That will prevent the worm from sliding back into the eye and behind into the brain. Now I've made an opening into the conjunctiva, which is not the seeing part of the eye. This is only the white portion of the eye. Now we can see some white cylindrical tubes, likely to be a worm. I'm pulling that out. And you'll be astounded to see the length of this worm. And mind you, it is a live worm. You can see the head moving. Now I'm trying to untangle it and pull it out. But I feel that the distal part, that means the end part of it, has got caught somewhere in the eye. Now I'll be putting the rest of the worm back into the eye, or onto the eye, not into the eye, in the hope that it will relieve itself from the eye. Now watch carefully as the worm starts wriggling out of the eye. Now it has wriggled free from the eye, and I can see both the ends. And this is the time I know that it is not going to go anywhere else. It is going to be here, and I have all the time in the world to take it out. And I can be reasonably sure that no part of the worm is now going to remain inside the patient's eye.
So yeah, he made sure he could see the head and the tail. That's why he laid it on the eyeball to let it wriggle out, so that he made sure he didn't leave any of it back in his eye. Isn't that amazing?
We have all the time in the world. No.
And that's just a picture of the porkworm. Look at it. See, look, there's the head. Look, there's the eyeballs. See it?
They have eyes.
But my point was, if you've ever seen that movie Snatch with Amy Schumer, so her and Goldie Hawn, they go to Ecuador, and she supposedly gets a tapeworm because she's having all this abdominal pain and diarrhea. Well, then she goes to the local doctor there in this village in Ecuador, and he's like, "You have a tapeworm," and so he's like, "And it needs to come out." So what he does is he sits her in a chair and he dangles a piece of steak in front of her mouth. And so they're filming it and you see this tapeworm, which it's really not true, you can't get it out this way. But it sees the steak and it starts darting out of her mouth and it latches onto that. And so here's this doctor trying to pull the tapeworm while Amy Schumer's freaking out when she's got this tapeworm in her mouth. If you see it, I tried to get a clip of it, but it wouldn't let me get the clip. But if you see this movie, it's on DVD now. That was the funniest part. I was dying laughing when they were trying to get the tapeworm out of her. And she runs off, and this tapeworm is still dangling around her mouth, out of her mouth. How do you prevent tapeworms? You avoid ingesting soil that can be contaminated with human feces, including where human fecal matter, night soil, or wastewater is used to fertilize crops. Wash your hands with soap and water before handling food. Teach children the importance of washing hands to prevent infection. Wash, peel, or cook all raw vegetables and fruits before eating, particularly those that have been grown in soil that have been fertilized with manure. Cook meat to save temperature. A food thermometer should be used to measure the internal temperature of cooked meat. Do not sample meat until it is cooked. Y'all remember that when she gave away cars? You get a car, you get a car, you all get a car. Questions?